These are ordinary people doing extraordinary work. Marie Boltz. I'm a professor and Associate Dean for Research and Innovation at Penn State College of Nursing. November is National Family Caregivers Month, and it's really focused on honoring and thanking all the people who care for somebody who is sick, who is dying, who is dealing with disability. And currently, there are about 35 million caregivers in the United States, and they provide approximately $600 billion worth of care. That is more, and that's per year, and that is more than what we pay for Medicaid in this country. Caregivers include family members who might be an adult child caring for an older parent. They might be a parent taking care of a child. They might include a spouse taking care of a partner or another spouse, a friend taking care of a friend. And they do extraordinary work. Our focus this month is based on the theme Plug into Care. So really this month, we're really focusing on getting caregivers the resources, the tools, the education, and also a sense of community around caregiving. There are many rewards of caregiving. They develop a close relationship with their loved one. They learn new skills. They also have the chance to enact their values, to really act out what's important to them. But we also need to remember that there are challenges associated with caregiving. For many people, there are economic strains. They need to stop working or they need to modify their work. They also need to pay out of pocket for supplies. It's an average of $7,000 a year that a caregiver has to pay directly. But also think about, that economic loss related to the job and how much we rely on these folks to really be an essential part of our healthcare delivery system. One of the most important things we need to do is recognize them and thank them. Many people who I've worked with in practice as well as my research have told me that one of the biggest challenges with being a caregiver is not being acknowledged for the work they do. They feel alone. No one knows what they're going through. So simply acknowledging their work and thanking them is really critical. Provide concrete help. Ask them what they need. Things such as providing errands, coming in and sitting with a family member so that the caregiver can pursue perhaps a nap or working in the garden or something that's important to them. Give them a break. Also advocate for them. Advocate for policy in terms of paid family leave, policies that support employee assistance programs for caregivers, policies that support reimbursement for all this care that they're providing in the home at no cost to our current reimbursement systems. Caregivers are immersed in care, and I think that that's something we forget. We go on with our daily lives and we're not recognizing that a caregiver is thinking and preoccupied and consumed with care. So that's an immense psychological and emotional burden. Also, the physical aspects are very demanding. So when we give them a break, we're really helping them sort of walk away mentally, perhaps, from this caregiving, and also give them a physical break. So they are really essential so they can continue to provide that kind of care.